Today I'm coming in front of you with new greetings from Citizens Hospital. We're going to discuss about a new modality of treatment in treating coronary artery disease called intravascular lithotripsy. You may recollect I've done a video, shared details of a case a few months ago on how to treat calcium that builds up inside the coronary arteries or the heart arteries of a patient. So I've showed a case on how we dealt with that by using a technology called rotablation. Here we're going to use a slightly different technology, but the purpose is same. It is to break the calcium so that a stent adequately expands. I don't have to reinforce that if you implant a stent that is not adequately expanded, it usually gives poor results and also poor outcomes in the long run. In other words, it does not achieve the desired purpose. So for this purpose, technology called IVL or intravascular lithotripsy has been developed, and it's finding its way into day-to-day practice even in India rapidly. We do quite a lot of these, and so far we've done more than 50 to 60 intravascular lithotripsy cases at Citizens Hospital. Today I'll share a case how IVL made a difference in achieving a good stent result in a 60-year-old patient. Today I'm going to share a case of a 60-year-old man who had a heart attack. In this angiogram you can see that he has a tight block over here. But what you can also appreciate is this dark area even before the dye is injected. This is due to calcium buildup, and calcium makes the stent procedures really difficult. And if we don't get this out of the way, then we won't get a good stent result, and that's not good for the patient at all. So there are various ways of getting rid of this calcium, but I'm going to talk about IVL today. What you actually do in IVL, you actually get this balloon across which has got emitters that emit ultrasound waves across the heart artery. As you can see, this is all heart artery, but all this white area is calcium. When these emitters emit ultrasound waves, they crack the calcium, and thus we will be able to put a stent and achieve a good uniform result. This calcium does not go anywhere, it's just simply squashed across the wall. So by using this technique, we inflated this IVL balloon all across the artery and debulked the calcium, and then we were able to deploy a stent. This is a stent between the two dots and achieve a final result that looks like this. So the end result is absolutely perfect here, where you don't see any of that block, and also there is no wasting of the stent, and it's uniformly expanded to the desired measurements. We also use a tool called intravascular ultrasound to assess the amount of calcium, and based on that we take a decision whether to use IVL or something simpler such as cutting balloon. And also once a stent is implanted, we again use IVAS to see if we achieved a perfect result or not. This was done about a month ago, and this gentleman came for his first follow-up and is doing absolutely fine without any further symptoms such as chest pain, and is back to his normal activities fully.